So, namaste everyone. Let us start. So today's topic is very important for most of us that are 60 plus, and it is about how to prevent the fall. And we have excellent presenter, Dr. Vibhakar Karambelkar, and he's a doctor in physical therapy from Utica College. He has over 30 years of experience in management of people with orthopedic and neurological disorders. And just listen to him. And he's in case you are in Washington D.C. area, he's in Virginia. His practice is in Annandale, so you can always approach him. And he'll be sharing the presentation slides with everyone. And again, you can contact him as needed. One thing, and if you have any questions, you can post them in the chat box, or you can ask them later after the session is over.
Good evening, everyone. And I want to specially thank Sabnis Guruji for giving me this opportunity to present this material to you today. And I also want to thank Alka for her, I don't think she is on the call yet, but for her motivation and support. So our topic today is fall, risk and prevention. So this is really intended for you to take care of either yourself or one of your loved one. So when we talk about falls, how do you define it? What is really considered a fall? By definition, it is an unintentional change in position resulting in coming to rest on any other level or on the ground. Conventionally, we think of falling to the ground as a fall. But really, in actual terms, when a person, for example, if he is trying to get up from the bed and then sits back down suddenly and involuntarily, then that is considered as a fall. Similarly, if a person is trying to sit on a toilet or on a seat, and if they can't control the last few inches and they plop into the seat, then that is also considered a fall. This is very important, especially in people who have the diagnosis of osteoporosis, because even that few inches drop can lead to a hip fracture. So I have experienced in patients in a very severe case of osteoporosis, the home health aide transferred the lady from her bed to the bedside commode, and it was a heavy transfer, and the person suffered bilateral hip fractures, that means on both the sides. So the seriousness is very severe, and we need to consider even the slightest fall as something that we have to take care of and prevent. So the risk is really high in older adults, and by definition, an older adult is anybody who is 65 or over in age. So there is 1 in 3 chance during the course of a year for an older adult to fall. We always cherish our independence. So this is what exactly the fall robs us of. It is a big threat. We often see people walking around the house and they're refusing to use an assistive device such as a cane, but yet they will hold on to the furniture and get around. So if you tell them that you need to use the cane, they will say, no, I want to preserve my independence, and that's why I don't want to use a cane. But this is something that you have to realize, that without that device, if they were to fall down, the independence, what they are trying to hold on to, is exactly what is lost. So when a person falls, there is a severe functional decline, and the independence that they are trying to hold on to is what is at stake. And the falls are not inevitable with age. That is very important thing to consider, because our mindset is such that our age is advancing, and what do you expect? We are going to have some falls, but that's not the case. So how big is the problem? It is really a very serious problem if you look at it from the statistics from the CDC or National Institute of Health. Every second of the day in US, every second of the day an adult falls, and every 18 seconds that requires a hospital emergency room visit, and every 35 minutes there is a death from falls. So that is the grave statistics. So the idea of sharing this with you is not to really scare anyone, but just to be aware of the risk associated with it. There are three major causes of death in older adults. Number one is considered as cancer. Number two is cardiovascular disease. And number three is injury deaths. And the fall tops the third category of injury deaths in older adults. So many people, when they fall, they have a simple solution. They say that I'm going to not go out. I'm not going to be walking outside as much so that I'll be safer, I'll stay indoors. So they will avoid situations where they have to go out. But it has been shown that more than 60% of the falls which are fatal have occurred at home. So when you restrict your functional activity like that, it reduces your strength and endurance and other functional capacities, and that itself becomes a risk for falling again. In terms of the incidence, women suffer the most as compared to men, because women have a longer longevity, and by age 90, 1 in 3 females have fallen or had a hip fracture. So the most common thing we associate with a fall is the probability of a hip fracture. But the other thing that we have to be very aware of is something called traumatic brain injuries. So you would think that for somebody to have a traumatic brain injury, there has to be a heavy impact on the head. But in an older adult, it is not so. Even if there is a slight tap as the person falls down on the head, or if there is a jerk to the head, that alone is enough to cause a concussion, because as we get older, the volume of our brain has shrunk a little bit, so there is more space for the brain to move around the skull, and at the same time, the arteries that go from the inside of the skull to the brain have hardened. So there are higher possibilities that there will be a small intracranial bleed from just enough jerk to the head. And one of the most famous examples that comes to my mind is, if you have heard of Dr. Robert Atkins. He was the proponent of Atkins diet. He was a very healthy individual, and he was practicing his medicine practice in Manhattan. He slipped on a small patch of ice one morning, fell down, had a slight impact on the head, and the next thing was in the news was that he passed away because of a brain injury. So seemingly very healthy person, but just a small fall, and that was fatal for him. So the other important thing that happens when a person falls down is that they develop a fear of falling. So that fear of falling limits them and causes further functional decline. And that itself, that fear itself becomes a risk of fall. So what do we do? So there are requirements nowadays. Since last several years, actually, the centers of Medicare and Medicaid services or many private insurances have taken upon themselves to collect data on falls. So what they do is that they require providers to ask questions to their patients. They want to know if a person has fallen within the last 6 months or 1 year. And if the person has indeed fallen in the last 1 year, they are considered as high fall risk. And in that situation, especially Medicare requires us as medical providers to refer the person for a fall prevention program. So the idea is to reduce injuries, reduce the ER visits, subsequent hospitalizations or nursing home placement, and functional decline. So all of this reduces the cost to the insurer, especially the federal program of Medicare, and then all other insurances follow suit and implement such guidelines. But in reality, we do not see a lot of referrals coming from medical providers for fall prevention. So even if the risk is identified, it does not really translate into the education at the primary care level that the person needs to get a fall prevention intervention program in place. Many of our patients, they come to us and they refer themselves. They say that we have noticed that we are not having a good balance anymore, and we want to be able to do better. Like, I'll give you an example. One of my patients, she was from an European country and settled in US since a young age. So at age 90, she was living alone. Actually, she was 88. She was living by herself, and she used to be very athletic and a badminton player in her young age. And she came to us requesting to start her on a strengthening program and balance program because she needed help to walk, especially outside with a cane. And she didn't want to use a cane. She wanted to be able to walk independently. And one of her goals was that when my friends come over, I want to be able to carry a tray with coffee cups to them without having to worry about falling. So some of our patients with especially neurological conditions, they come to us and they request a fall prevention program. But it would be nice to see more education from the primary healthcare providers as well. So when we look at the fall risk factors, there are two kinds of fall risk factors. One group of factors are modifiable. That means we can do something about it. And the other group is non-modifiable. That means we cannot do much about that. So among the modifiable risk factors, poor vision comes to the mind first. So it is very important. You are always requested to do an annual vision exam. So that is extremely important. At the same time, having night lights around the house is very, very important for fall prevention. So poor vision is one of the risk factors. Leg muscle weakness. As we get older, we tend to lose, you won't believe it, after the age of 30, 3 to 8% of our lean body mass. So that means after the age of 30, every decade, we are losing 3 to 8% of bone and muscle mass. So even though the person may maintain the same weight or gain weight, but the lean body mass is progressively declining. So you can imagine what happens by the time the person reaches 65 or more, and the leg muscles are very prone to weakness within 2 weeks of disuse. So, for example, if a person is hospitalized and then had to be in a hospital for a week or two, by the time they come out, their leg muscles have actually begin to atrophy. Then poor balance. So when the muscles are weak, they are not able to participate properly in balancing the person. At the same time, as we get older, there is vestibular loss, which is age related as well. And if there are any neurological conditions or peripheral neuropathy, that all contributes to poor balance. In fear of falling. So we mentioned this earlier. If the person has one fall, they are so guarded that they are afraid to fall again, and they start involuntarily, without thinking, subconsciously limiting physical activity. So the less challenging your physical activity gets, the faster you lose your ability to balance. Then difficulty in walking. So all of the above will contribute to difficulty in walking, plus any kind of orthopedic or muscular or neurological problems will impair your gait, and that becomes a risk factor. Then dizziness, vestibular deficits, and postural hypertension are three big things. So the dizziness is something when people feel that their head is spinning. Vestibular issues could produce vertigo, where the way to differentiate vestibular symptom is, if there is vertigo, is where the person feels that the room is spinning, not the head. And then postural hypotension is a situation where the blood pressure drops rapidly on change of position, and we are going to talk more about it. And that can cause lightheadedness or syncopal attack, and the person could fall. Polypharmacy is one of the things that we need to worry about. Anybody who takes more than 4 medications a day is considered as polypharmacy. So we are going to talk further about this. You need to really discuss that with your medical provider to make sure that there are no interactions that could increase your fall risk. The other modifiable factors are foot and shoe problems, so ill-fitting shoes or deformities of the feet, home hazards. There are multiple hazards in the home that we are going to look at later. Lack of safety equipment. So we tend to hold on to our habits and we don't like to change many things. But as we get older, it is a good idea to look into some safety equipment and make sure that our environment is safer. So to reduce that factor of risk. Incontinence, many a times with incontinence, there is urgency or frequency, and the person has to get up frequently at night and could cause falls. Low weight and frailty. So after the age of 65, it's not a very good idea to actively make efforts to lose weight, because we are already losing every decade the lean body weight, which is the bone and the muscle mass. And on top of that, if you are doing some kind of a diet that makes you lose weight rapidly without medical supervision, then it is not something which is recommended, because that would increase your fall risk. So some of our older adults, they suffer from a condition called failure to thrive. That means they are progressively losing weight due to some medical condition, or just because they have some issue which has not yet been diagnosed, and then those people are very likely to fall very frequently. And one of the last modifiable factor is depression. So when a person is depressed or have some psychological issues, it is very difficult for them to focus on other aspects of their life, and falls risk increases in older adults. Now we are going to talk about some unmodifiable factors. So these are the factors which we can influence a little or not. So somebody over 65 years of age, as we saw, that progressively with every decade, the fall risk increases no matter what. Then history of falls. So they have established that person who has fallen once during the course of the year are at high risk. Women more than men, again, because they live longer lives because of their longevity. They are frequently functional and able to walk around until quite old age of more than 80 or 90. Poor sensations in feet and leg, that is the peripheral neuropathy, cognitive impairment, and chronic diseases. So these factors we can influence partly, but not completely. Now we are going to look at some of the modifiable and unmodifiable factors in a little more detail. So we talked about polypharmacy earlier. So here you have to see, we always understand our medications, we know about the side effects and the effects that they have on us. We have our conversations with the doctors, but it is also a good idea to find out about drug interactions. So if you are on multiple medications, do talk to your doctor about if there could be any possibility of drug interactions, and if any of the medications could cause risk of fall, because like medications that are antipsychotic or diuretics or cardiovascular drugs like beta blockers, they have been known to increase the fall risk. Then cognitive impairment. This is something that will affect a person's short-term memory, problems with abstract thinking, attention, and information processing. So anybody who has cognitive impairment, you will be able to notice some early signs and symptoms. And these signs and symptoms would be present in most of us. We experience this quite often. They become, or they should be considered a problem only if they are affecting your activities of daily living. If because of these symptoms, you are not able to do certain things and it is impacting your day-to-day life, then they are to be paid attention to. For example, missing appointments for important events, having difficulty in decision making or planning, like cannot balance a checkbook, forgetting words or sentences, forgetting conversations, and having difficulty in following multi-step directions, and getting lost in your own town. So another sign of cognitive impairment and a risk that the older adult could get into a situation of a fall or injury is wandering. So if somebody has this diagnosis of cognitive impairment, that is something that you have to really be careful about, because they do tend to wander and leave home and then forget where they are going. So the risk with cognitive impairment is that the awareness for safety is lacking. and it leads to poor judgment. So the signs that you can look at, the signs that you can look at are that the person may slowly, person who is a good dresser suddenly loses the sense of dressing properly, or they uh, or they exhibit any of the previously mentioned signs and symptoms, and they are making decisions that could compromise their safety. So what do you do? So this was considered as a non-modifiable factor, but it is very important to get a neurological consult, because when a neurologist sees and diagnoses this condition, they are also looking for any reversible causes of cognitive impairment. And then not only medical management is important, but occupational therapy is very important in this situation, because a referral to occupational therapy, if you seek, they can do further testing, like the clock draw test or mini mental state exam, and then they will work on the activities of daily living, because they will have difficulty in these activities because they cannot put together a complex task. So the task that is really simple for us as a daily activity, like for example putting on a shirt and buttoning the shirt, could become difficult for them, or planning what to wear, or how to take a shower can become difficult for them. So these are the tasks and cognitive skills that the occupational therapist will practice with them, in addition to providing caregiver education regarding safety in the home. With incontinence, the most common situation where the fall occurs is when they make attempts to go to the bathroom at night. And most of the times they are rushing, and they have just gotten up from sleep, and then probably there is not enough lighting, and then they tend to fall. So the signs of incontinence are to be identified as early as possible and get the interventions in place. So when you do the consult with the urologist or your primary physician, they will check for any increased frequency during the night, or urgency, or stress incontinence, or pelvic floor muscle weakness. Pelvic floor muscle weakness can lead to incontinence, especially in women, and can be actually dealt with through exercises and physical therapy. It comes under women's health, and as a physical therapy specialty, they can take care of it. Then the doctor will also assess for signs and symptoms of urinary tract infection. So if there is a chronic and recurrent UTI going on, that would increase the frequency or urgency, and then could lead to incontinence and risk of falls. In an older adult, the urinary tract infections are to be really something to be careful about, because they may not show the regular signs of urinary tract infection. There may be no fever, there may be no pain, there may be no burning. The only sign sometimes people might show is a state of confusion. So if you notice in your parent or in your spouse or anyone that suddenly someday they appear a little confused or not themselves, then it's a good idea to get them to the doctor and check if they have a UTI going on. Then the doctor will educate in setting up voiding schedule. Some seniors, they would stop drinking fluid to take care of the incontinence, or minimize their fluid intake in the afternoons or night. So that is not appropriate, and then it needs to be taken care of. And then getting that infection treated is very important. The postural hypertension that we mentioned earlier is associated with position change. So it is generally due to the cardiac causes or hydration status or medication. So if there is a drop of 20 millimeters in blood pressure with a position change, and that is usually diagnosed by the nurse or the doctor, then it is considered as postural hypotension. And many a times it is accompanied by lightheadedness or a syncopal attack, and it can definitely lead to a fall. So a MD consult is very important. At the same time, a lot of ankle pumping exercises, hand clenching, and use of pressure stockings have been effective. Then the musculoskeletal changes. The loss of muscle mass in elderly, we did mention this earlier. It is progressive and unrelenting. So that decrease in muscle strength and tone, decrease in endurance and mobility, and stiffening of the joints, especially of the legs. And as a result, if there are foot deformities, they are a big contributors to fall. So the way to maintain the muscle mass or prevent or slow the decline in the muscle mass is by way of making sure that your protein intake is good in your diet. Even smaller portions of food, because as we get older, we cannot eat larger portions. So make sure that you have energy dense foods and protein dense foods in smaller portions. At the same time, participate in resistance exercises, and that way you will slow down the decline in your muscle mass. So what will a physical therapist do in this situation? So if you do seek physical therapy advice, they will record your range of motion to determine the stiffness in the joints. They will check your strength, posture, joint deformities, and then come up with a very customized exercise program to address those specific conditions. So which will include exercises for range of motion, stretching, strengthening, as well as balance activities. Abnormalities of walking. So we mentioned it as a risk factor, which is modifiable. So what are the abnormalities of walking? Reduced walking speed. So this is one very frequent abnormality of walking that happens as we get older. So you must have seen people who are in their 80s walk really slowly with smaller steps and poor posture, like a flexed posture. And then they cannot coordinate walking and talking at the same time sometimes. If you talk to them, they have to stop, turn to look at you, and then talk. They cannot be doing all of this together. So it is now considered that the walking speed is a sixth vital sign, meaning it is an indicator of vitality of human being, and it is associated with cognitive impairment, risk of falls, as well as life expectancy. So after the age of 65, the way to maintain walking speed is through physical activity. That means if you maintain your strength, balance, and mobility, only then you can maintain your walking speed. We test walking speed based on an evidence-based test. It is tested on a distance of 25 feet, and ideally it should be under 6 seconds. So if you are not able to walk a distance of 25 feet in less than 6 seconds, or even better, under 5 seconds, then you definitely need to work on these aspects of your strength, mobility, and endurance and balance. So that is one of the main factors that we work on in elderly, is to make sure that their walking speed improves. So when we see anybody who is over 65, we make all these records, and then when we do a progress evaluation, we see the differences and the strides that they have made based on these tests. Then deviation gait in terms of smoothness, symmetry, time spent in double stance, meaning how long of a time is spent with both feet on the ground. So these parameters nowadays, if you have an iPhone, in the health app, it will tell you. If you just take a look in it, it will even tell you your walking speed probably, as well as the steps you took, and it will definitely tell you the time you spend on double stance, symmetry of walking, and all of this. So you can actually get quite easily a quick report on your walk if you are using one of the Apple iPhones. Then difficulties in initiation of gait. So many a times, if you are lacking in the lower extremity muscle strength, or if there are any neurological conditions ongoing, then initiation of gait is difficult. That is, upon standing, starting to walk becomes difficult. And that is the time when many people fall down. Then foot drop is associated with peripheral neuropathy or PVA, that is cerebrovascular accidents after a stroke, decreased step length. So if your balance is poor, then you do not feel confident in taking the normal length steps. So the person tends to reduce the step length. And when somebody is walking with any of these deviations, that becomes a significant fall risk. So what are the interventions for ambulation? So the therapist will work on gait training. That means they will train a deviation-free walking pattern through range of motion exercises, stretching and strengthening exercises, balance exercises, weight bearing and weight shifting exercises. And if necessary, they will recommend assistive devices and then continue to monitor the progress. So we will now talk a little bit about the balance. So the balance impairment is a very complex area, and it is due to one or multiple system impairments. So it could be your musculoskeletal system, it could be your nervous system, the visual system, vestibular, or the sensory system, or a combination of this. So any conditions, if you are experiencing originating from these systems, will cause impaired balance. So in physical therapy, we do extensive balance testing on all individuals over 65. We employ something called a Berg balance test, timed up and go test, which checks the person's ability to walk a distance of 10 feet. After they stand up from a chair, they walk the distance, turn around, come back, and then sit down. So we are checking multiple parameters. We are checking the transfers, the initiation of gait, the walking speed, as well as ability to change direction. And it is a test which is accepted and required by Medicare, that we provide scores of this. So anybody who takes longer than 15 seconds to get up from a chair, walk a distance of 10 feet, come back and sit down. If they require more than 15 seconds to do it, they are considered as risk of high risk of fall. So it should be less than 15 seconds to do that test. Then 5 times sit to stand. So it's a simple task, but then it is also a standardized test that we look at and then measure progress by means of this. Then the Romberg's test is a test of balance that we do, which checks our vestibular system as well as the peripheral muscle and joint system that contributes to balance. Then functional reach test. So many times people lose balance when they're trying to reach shelves in the kitchen or reaching forwards over the base of support. And then the modified clinical test of sensory interaction in balance, which is called the modified CAT-SIB. That is also a very sensitive clinical test that we do. So once we determine the, the baseline for the balance, we are able to customize a balance program for our patients. So that includes a progressive set of exercises, which progresses from static to dynamic, which are done progressively from eyes opened to eyes closed situations, and then increasing the difficulty level by doing them in sitting, standing, step standing, and in walking. So some are weight bearing exercises, some are weight shift exercises, and then there are strengthening exercises. And then I don't need to tell you about yoga. It is one of the best methods of training balance, and Tai Chi. So trying to expand a little bit on the balance exercises, the static exercises where the person is still are done either with eyes open or eyes closed. So as simple as standing with feet together with eyes open and then eyes closed. So each position has to be maintained for 30 seconds. So whenever we recommend any of the balance exercises to be done at home, we always tell the person to stand in a corner of the wall and have a chair back facing them. So they have something to hold on to just in case, and the corner of the two walls behind their back so that they do not suddenly fall. So standing with feet together with eyes open and then closed for 30 seconds. Then standing weight shift from one leg to another, tandem standing, single leg stands, that is standing on one foot, and while standing doing some upper extremity dynamic activity like reaching or catching and throwing a ball, and then standing on a foam or uneven surface. I'm going to talk a little bit more about these in a minute. Then the dynamic exercises are heel to toe walking, side stepping, crossovers, and stepovers. And when it comes to balance, we have, as you already know, that multiple systems helping us with the balance. The primary systems that help us with our balance are our vision and the vestibular system. The vestibular system is inside our middle ear. And then they work in synchronization with the part of our brain called the cerebellum and give signals to our musculoskeletal system which are our joints, bones, and muscles, to keep our body upright. At the same time, allow the head to follow the eyes and the body to follow the head. So when you close your eyes or open your eyes, you are either adding or removing the visual input. So when you close your eyes, you're relying only on your vestibular system. When you open the eyes, the vision helps. So, and then when you turn your head, there is vestibular compensation, and then it has to calibrate the position of your eyes with the head turned, as well as then position the body accordingly. So some of the exercises we practice are targeted specifically at the vestibular system. So these are very simple but quite hard to do. You have to make a small target on a piece of paper and hold it at arm's length, and then turn head side to side with your eyes fixated on the target. So eyes on target, turning head side to side, then eyes on target, nodding head up and down. So all of these are done continuously for 30 seconds at least. And then they are progressed from sitting to standing to walking, as well as to be done in step standing. Then we have the person walk slowly, turning the head side to side. So it is called walking with head turns, and also nodding the head up and down. Then there are exercises such as which are directed at ankles, which are the ankle sways and the circle sways, because our ankles and foot are one of our main contributors to staying upright, because they are constantly adapting to the surface, and on our feet then all the other segments are balanced: the legs, the thighs, the pelvis, the spine, and the head. So the feet are extremely important but most neglected. So these are some pictures of exercises that you could do very simply at home. So these exercises are hip strengthening. So basically you are moving the hip in all directions, forwards and up, sideways and backwards. So, so this one is sit to stand. It is going to help strengthen the hip and the knee. So the 5 times sit to stand test is based on this movement. And for any older adult, if you do this maybe twice a day for multiple repetitions, it really helps strengthen the legs, and it is a functional activity, so it will help you in your day-to-day function. Then heel raises. Through research, it has been shown that for the older adults, if they have to do only one exercise, then this is the one that should be done, heel raises. So that is very important for the strength of the leg as well as for the balance. And it primarily strengthens the calf muscles. Those are very important because they are our propellers. They propel our body forwards. Then single leg stance, it is a static balance exercise. Ideally, you should be able to stand on a single foot and be able to maintain it for 30 seconds. But if you are unable to do so, at least 10 seconds is a good start. Then the balance pad I talked about earlier, this is the recommended balance pad. It's called an ARX pad. So all you have to do is stand on it with feet together and then practice it with eyes open with some support next to you. So you should really ideally have the chair in front of you and stand in a corner. So again, the ability to maintain the position for 30 seconds is critical. Then this one is called tandem standing. So you stand on a heel to toe base. It is a very narrow base, so you have to be careful. Again, should be done in a corner with a chair in front. And if you are practicing walking in a tandem stance, then it is considered a dynamic exercise. This is side stepping. So in this picture, the person is shown doing it against resistance with a yellow elastic band around the ankles. But you do not have to use an elastic band. You do it without it and take big steps sideways in a slightly flexed position for strength and balance. These are crossovers where you crisscross the legs. Again, if you are already having issues with balance, do not do this alone. It has to be done with somebody next to you, like a caregiver. And then these are the step overs. It trains proper height of stepping and also balance on single foot. So the vestibular exercises that I mentioned earlier are also called the gaze stability exercises. Many people lose balance when they are in busy environments. So like, for example, if they are in a very wide open space and with a lot of people walking around, like for example, in a mall, they feel a sense of loss of balance. That is because of lack of gaze stability due to the vestibular dysfunction and vestibular decline with age. So if you do this exercise where the eyes are on target and you turn your head side to side and then repeat with head up and down with eyes fixed on the target in hand, that will improve the gaze stability and in turn it will improve the balance. Then walking with head turns. So all you do is like walk in the hallway of your house, look to the right and then look to the left, as if you are walking in the supermarket aisle and looking at the shelves. It looks very simple, but believe me, people find it very difficult to do sometimes. And then walking with head nod. So you're looking up and down while walking at the same time. And then these are the sways. These are the ankle sways. You just lean forwards and back and side to side. To elicit this will elicit the balance reactions at the ankle. So we have a lot of balance reactions which we did not talk about. These are called the ankle strategies, knee strategies, and hip strategies. So basically, if you start losing balance backwards, the body has compensatory mechanisms which will increase the tone in certain muscles and correct your position. But if that is not enough, then it has you take a step. And then if that is not enough, it makes you hop and then correct the balance. And then these are some of the yoga poses for balance. I'm not going to say anything about this because we are sitting with our Guruji Sabnis sir, and he is the expert on that. So these are like the standing asanas are really good for balance. We mentioned hazards in home as some of the factors that contribute to falls. Our home is full of hazards. So if you notice uneven floors, cluttered pathway, loose or buckling carpets, it is a big fall risk. Similarly, um, the plush carpeting in the bedrooms and hallways feels good, but that can cause people to fall, especially older people. So the best kind of carpeting for them is low-rise commercial type of rugs or wooden floors. So if you have area rugs in the home, it's a good idea. If you have an older adult living with you, then please remove them, because no matter how secure they are, it will cause the person to trip. Then always make sure that you improve your lighting, especially at night. So the switches should be easily accessible, as well as having night lights around the house is very, very important. Then you have to pay attention to the footwear. So any kind of poor fitting footwear is not recommended, which includes slippers, which includes shoes without any heel cover. So the shoes that go around the heel are always recommended, that will hold the foot properly. And if you're wearing any kind of slip-on bedroom slippers, that's not a good idea, because that makes you shuffle. Because if you have a slipper of that sort and you lift your foot up high, they can come off loose. So people end up shuffling their feet and walking, and that could increase the fall risk. Slippery and wet floor surfaces, we all know, and unsafe bathrooms. So the same bathroom that is safe for a younger person could be unsafe for an older person. And pets. Pets around the house is a big hazard. So how do you improve safety around the home? So to improve safety, you start with the bathroom first. So there are various kinds of grab bars available, which can go on the wall, it can go on the tub or on the toilet. Make sure you have slip resistant mats and raised toilet seats. Similarly, having a shower chair is very important, because if if somebody is quite old, it is not a good idea to shower them in standing. It is best to have a shower chair or even a transfer tub bench. So transfer tub bench eliminates the need of stepping over the tub. But if you have a shower stall, then a shower chair with a handheld shower is quite enough. Then improve the transfer safety by use of a bed cane and a bedside commode. A bed cane is a handle on the bed which is very easy to install. So they can get up and sit easily, and then be able to transfer from sit to stand very easily. And having a bedside commode is also something very essential, especially to avoid any falls during the night. And improving safety while walking. So very commonly people miss the edge of the step and fall down. So marking the edge of the steps with some fluorescent tape, or having non-slip carpeting on the steps, handrails, removing any door thresholds, and having skid-proof shoes and slippers. So again, there is something you have to pay attention to when you're using shoes. You don't want very, very grippy shoes either, because if the shoe is very grippy, it still can get caught on the floor or in the rug and can cause a person to trip. Then removing of all the loose area rugs or securing them with two-sided tape, and clearing clutter from the floor like rugs, toys, cards, wires, clothes, etc. It's not a problem anymore, but earlier the phones used to be a big problem with all the long cords that came with it. So So that is not much of an issue right now. But the wires still could be, which are now the charger wires. Then improving general safety around the house. So storing the most needed items at a lower level so you don't have to reach up high, because when you reach up and then you lean past your base of support, you could easily lose balance. Then enough lighting and easy access switches, phone near the bed, night lights, and something that we should look into also is the PERS machine, which is the Personal Emergency Response System. So these things are very important to have because they give you a necklace button or a bracelet button, and then there is a device that you can talk through if you fall down and call for help pressing the button. These buttons are also installed in the bathroom at floor level and also in the bedroom at floor level. So if somebody falls, then they can press the button and summon help. And the machine itself, the unit, has a speaker, and the person who is on the other end can talk through that machine to the senior who is probably on the floor. So these are some of the pictures of the things we talked about. So this is a wall grab bar. The next picture is the toilet safety frame. So it is very, very easy to install, but that gives you a good solid surface to hold on to and stand up from the toilet if it is low. Or you can nowadays install the ADA compliant commodes, which are much taller. So if you have a low rise commode, then you can add a 2-inch toilet seat. There's a particular seat called the Savannah raised toilet seat, which is snap-on and very easy to get up from. You don't want a 4-inch because 4-inch is usually too high and can cause the person's feet to go above the ground. This is the shower chair, and then the next one is the transfer bench. So shower chair requires you to step over, but the transfer bench you can first sit and then swing the legs over. This is the bedside commode. So it can be used by the bedside because it has a pail attached to it, or the pail can be removed and this whole frame can sit up over the bathroom toilet, and then the person has something to hold on to, as well as the height can be adjusted. This picture is the bed cane. It is attached to a wooden piece which is slid between the bed and the mattress, and then that gives you a secure surface to anchor the cane, and then you can hold on to it and get up and lie down or stand up. So what are the primary steps that will help you prevent falls? So participating in regular physical activity, removing hazards in your home, reviewing your medications regularly to see if there is anything that could result in a fall, having your vision and hearing checked once a year, and then talking to your family members and enlisting their help, and having a home safety evaluation if necessary from a physical therapy person. So that brings us to the end of our presentation. And if you have any questions, I'll be very glad to answer. So I hope it was helpful, and I know it was a lot of information, but if you have any questions now, it will be nice to have. Otherwise, you can also send us the questions later.
So it was wonderful session and very helpful and kind of eye opener. You don't think that what can go wrong, and there's all these things that you talked about. And as we are getting older, it's important to know what can happen and what needs to be done. And this was a very, very, very helpful session. Thank you very much, Dr. Vibhakar. And again, if you have any questions, I think Shama, did you have one question about what can be done for leg cramps? That's one question that I see.
So the leg cramps can happen due to various reasons. It could be associated with some electrolyte imbalance, which your primary physician will be able to address, or it could be from stiffness of your calf muscles, as simple as that. And then there are certain exercises that will help relieve it, or it could be due to any neurological condition, especially people who have high tone would get cramps in the leg. So in your case, most likely it could be due to some stiffness at the ankles and at the knee.
Geeta, do you have a question?
No, thanks. It will be very, very helpful to us in near future.
Okay.
Thank you very much. Namaste.
I have a question. Is this recording available?
Yes.
Okay.
Yes. I'm not. I will be posting it on Shri Yoga, and I will send a copy to Vibhakar. If you are on the distribution list for Shri Yoga, then you will get it. If you are not, then you can just add your email to in the chat box, and that will be sufficient. Then I'll be able to post it to you. Okay. And it will most likely be on the YouTube also, so you can search it.
Okay.
Excellent presentation, absolutely helpful, and thanks a lot.
Thank you.
Very much. Excellent presentation.
Thank you very much.
Thank you.
Thank you.
Thank you very much.
Thank
Good
you.
evening.
One more question I have. Any guidance for taking care of osteoporosis if it has already happened, or it is, can it be reversed?
Actually, with osteoporosis, the person would already be on medication management, medical management of osteoporosis. In addition to that, getting the bone scan and what is the extent of osteoporosis is important, which I'm sure has been done already. And from physical point of view, weight bearing exercises, which is like walking, low intensity weight bearing exercises, resistance exercises, and proper nutritional supplementation also is very important.
Thank you.
I just have a question. You mentioned that bone mass loss is a natural process and it starts after the age of 35.
Yeah.
Now, my question is, whatever bone loss has happened. It can't be probably reversed. But is there any method by which I can assess what is the bone mass left? And if there are any remedial measures for that, I would like to know that. And also I would like to know if there are any, follow-up tests by which I can assess whether the remedial measures are working in my case.
Yeah. So your doctor can recommend a bone scan where they exactly can say how much bone loss has happened at the critical areas where they look for the bone loss, which is pelvis, hips, and spine. So
can I interrupt for a minute?
Sure.
For a second.
Mm-hmm.
See, I was talking about the muscle mass
Muscle
loss.
loss? Oh yeah. Oh, so that's different from bone loss. So the muscle loss you cannot quantify, but we are able to, in physical therapy, test your muscle strength. And we have various functional tests designed to really quantify your muscle strength. So that can be done, and with proper resistance exercises and proper mobility exercises, you can actually reverse that and be able to improve your even muscle girth, which can be measured by centimeters in circumference of certain muscles, as well as improve your strength and function through resistance and weight bearing exercises.
So essentially, to improve the muscle mass, resistance exercises and what is the other type you said?
Weight bearing.
Okay.
Weight bearing exercises,
These
where
are helpful.
your body weight is on your legs.
Yeah.
So those kind of exercises, and any exercises that incorporates resistance training.
Yeah. Thanks a
I
lot.
have a question.
The lecture was sorry.
And then the protein diet, like higher protein in your diet.
Okay. Your talk was very helpful. I am suffering from osteoporosis, but your talk is very helpful in that context also. Thank you very much.
Thank you.
I have a question. Thank you for the wonderful session. If someone has bone loss, how often should they be doing the bone density test? Because once after 50, the bone density test is done, but then after that, nobody talks about it. And is there a certain interval we should be doing the bone testing or bone density test?
Yeah, I wouldn't be the right person to answer that question, but
Okay.
your doctor who has put you on the osteoporosis medical management, based on their initial results of the bone density, they will determine the risk to what is the current status and how high fracture risk you are. And then based on that, they will determine when to repeat the test.
I see. Okay.
And
Because
the dosing of medication.
I see. Because when first it was tested, it was normal, but then after certain age, it keeps getting worse. So I was wondering how often it should be done. So
Right.
doctor will tell you.
Yeah, the doctor will be the one, or you can advocate for yourself and then request it.
Yeah, okay,
And
that's what my question was. Is it okay to request the doctor
yeah,
to
you
do
can request it. Like if you know that a certain time has elapsed, and if you see any pain, if you notice any pain in your spine or back, chronic backaches or neck pains, and then if you think that your function is deteriorating, you can ask them to have you assessed for the bone test again, and then get you referred for physical therapy. That is very important for your posture, balance, and strength.
Okay, thank you so much.
Lalita has, I think most likely Lalita has a question about how do we get assays for fall risk?
Yeah, so a physical therapy evaluation will assess you for the fall risk. So if you are experiencing any difficulties in balance, or if you are worried about falling based on the information that I provided, if you have any of the risk factors, you can actually request your doctor to give you a referral for physical therapy evaluation for fall risk assessment.
Oh, that's nice.
Doctor, I got a question about leg cramps. If you can highlight exercises or variation there, we could do at home. If you can guide us, I'll appreciate that.
So do you have any other conditions of the leg that you would like to share?
I get periodically severe leg cramp, either on one leg, and I'm slipping fast, and I'm sound slip, and all of a sudden you got a pain, and you can walk around in the house in a hallway, and hopefully that goes away. Or sometimes you hold on to the wall and raise your heel up and down. and stuff like that. But I'm just wondering, there is any better exercise?
Yeah.
Right?
So the primary exercises, there are two primary things you can do in terms of exercise. One is ankle stretches, stretching of the ankle so that it will stretch your calf muscles, and any exercise that stretches your knee to be more straight. So keeping your legs straight in the bed and then tightening your front thigh muscles and pushing the knee into the bed. And then that's one. And for the ankle, you loop a strap around the foot and pull the forefoot towards you and push the knee down to the bed to stretch the knee and the ankle towards you.
Thank you.
Just one question, if I may ask.
Yeah.
Thank you very much. It's very helpful. I just one small question. Is swimming of any use to increase your balance and other problems?
Yes, swimming is one of the very good exercises that you could do. It has a very good conditioning effect on all your joints, muscles, and bones. And at the same time, it is a resistance exercise because you are getting resistance of the water. And you can do, other than swimming in the water, you can do a lot of activities and exercises like walking or moving your arms and legs, and then trunk exercises. And the benefit of that is if you have pain in the joints, that is minimized because of the pressure of the water and the weight relieving effect of the water. So that's really good.
Okay. Thank you. And I mean, if you're thinking of resistance exercises, weight bearing exercises, swimming, what is the value?
Will qualify, yes.
What is the value of each one? Which is better than the other? Any
Swimming will qualify for the resistance exercises and doing exercises with less pain. And for weight bearing exercises, you can add walking to it. Because the buoyancy of the water will not make it a weight bearing exercise.
Okay. All right. Thank you so much. It's very, very informative, very useful. And I'm so happy that it is recorded. Thank you.
If there are no more questions, we can stop at this point. Again, this will be recorded and will be made available soon, most likely on YouTube, and I will share the link with all of you, whoever is on Shri Yoga and also on different other groups as well. Okay. And I will certainly, Uttaranga and other places, I may be able to share that. Thank you.
Thank you very much, Guruji. Thank you. Namaskar, everyone.
Thank you very much.
It was very informative.
Thank you.
And again, Vibhakar is in Virginia. It's if you are in nearby area, you are quite welcome to talk to him. He's in Annandale. I will provide the details about his office and email contact and so on. So thank you very much.
Anybody is welcome anytime, even if they just want to stop by, say hello, and see our office clinic.
I'm going to do that this week.
Okay.
Thank you so much.
Thank you.
Thank you.
Thank you. Thank you.
Thank you so much. Very informative talk. Thanks.
Thank you.
Thank you. Acha Guruji, namaskar.
All right, namaste. So I'm going to end the session. Thank you.
Bye-bye.
Bye.